Asthma is a condition in which a person's airway becomes inflamed, narrow, and produce extra mucus which make it difficult to breathe. Asthma can cause due to genetic factor or environmental factor. In genetic, the child receives gene from parents, and environmental factors include exposure to house dust, pollen, smoking, air pollution, or exposure to animal dander. Usually, with every breath you take, the air goes through the nose or mouth down into the throat and into the airway. Airway is a tube-like structure that allows entry and exit of air within the lungs. It is surrounded by smooth muscle that helps in maintaining airflow by contracting and retracting. There are mucus glands within the airway that secrete mucus which help to remove foreign particles that come in while you breathe. When you breathe normally, the muscles around airway are relaxed, letting air move easily and quickly. During asthma attack, the muscle around airway becomes tight. When they tighten, it makes your airway narrow and air cannot flow freely through the constricted airway. The lining of your airway becomes inflamed and swollen. Swollen airway don't let as much as air in and out of your lungs. And also the airway produces more mucus as a part of inflammatory response and to remove irritant out. That makes it difficult to breathe. Along with difficulty in breathing, person may also face chest tightness or pain, wheezing while exhaling, trouble in sleeping caused by shortness of breath, and coughing. There are many classifications of asthma which are as follows. Classification based on causes. Allergic asthma. It is caused due to allergic reaction. Non-allergic asthma. It is caused by inhalation of irritant from air. Mixed asthma. In this, the reason can be both allergic and non-allergic. Cough variant asthma. It is a type of asthma where main symptoms is dry non-productive cough. Exercise-induced asthma. A type of asthma where symptoms are triggered by exercise. Nocturnal asthma, where the symptoms appear at night. This happens because airway functions slow down just before sleep and functional capacity reduces with sleep. Classification based on severity. It includes intermittent asthma and persistent asthma. Persistent asthma is further classified as persistent mild asthma, persistent moderate asthma, and persistent severe asthma. In intermittent asthma, the symptoms appear less than 2 days a week. In persistent mild asthma, the symptoms appear more than 2 days a week. In persistent moderate asthma, symptoms appear daily but not throughout the day. In persistent severe asthma, symptoms appear daily and throughout the day. Classification based on onset. Adult onset and pediatric onset. In adult onset, asthma starts after the age of 18. Pediatric asthma, also called as childhood asthma. This type of asthma often begins before the age of 5 and can occur in infant and toddler. Asthma is diagnosed using following tests: chest X-ray, sputum examination, chest MRI or chest CT scan. Treatment for asthma is hidden within its name, that is, drugs like adrenergic, steroid, theophylline are given. Proper hydration should be maintained, mask for oxygen, anticholinergic drugs are given,